Good evening. You're listening to WEFT 90.1 FM, Champaign, Illinois, streaming online at www.weft.org. Welcome to SEIU Progressive News, bringing you the many voices of your community. This show is produced live in the studios of WEFT 90.1 FM at 113 North Market Street in beautiful, vibrant downtown Champaign, Illinois. The views and opinions expressed on this program are solely those of the speakers and do not necessarily represent those of WEFT, Prairie Air Incorporated, UCIMC, UPTV, any board of directors or staff of those organizations. This program is a collaborative effort. Please email WEFT90.1@gmail.com with your program ideas to get information on being trained to be a citizens reporter or to be a WEFT host. We are indebted to WEFT and its members who currently and who have for 35 years provided the infrastructure for independent media. We're indebted to the Public Eye, WRFU, UCIMC, and UPTV for their collaborative efforts. Here are the times and places that you can tune in to SEIU Progressive News. Of course, tonight, Monday, 6 to 7 p.m. live on WEFT 90.1 FM or streaming at that time on WEFT.org. If you want to listen through your smartphone at that time, you can use the TuneIn app, TUNEIN. So if you want to listen at that time but don't want to tune into your radio, your old-fashioned radio, use your smartphone. It's replayed Thursday on UPTV, local cable channel 6, thanks to Jason Liggett, and available by WEFT Podcast 24/7 through iTunes, SoundCloud, or your favorite podcatcher. We usually have it up there by Tuesday. It's available as an audio archive at weft.org through Radio Free America, so that's immediately after the show, and for 2 weeks following, you can hear it by going there. And it's now available on WRFU Radio Free Urbana at 104.5 FM Wednesdays at noon and Fridays at 7:30, thanks to Neil Partham for that. We're going to start out with some announcements. We're going to have some information, update about the MAP referendum, the Illinois Redistricting MAP referendum. We're going to be talking about David Gill's campaign, his victory that he just had with regard to being an independent on the U.S. congressional race. And then we're going to have a little interview with Ricky Baldwin of the laborers from a labor report. And then at 6:30, we're going to have Claudia Lennhoff in the studio with us. And Claudia and I are going to be discussing behavioral health, mental health services in Champaign County and how that looks with regard to the Times Center, but also how because that kind of ties into homelessness. And I want to talk about that with her. She's on the task force for the Department of Justice grant, the CRPC, it's called Crisis Response Planning Team. And so we'll be talking to her about that. And then as she works for Champaign County Healthcare Consumers, we really want to dig into the state of the Affordable Care Act in Illinois and what's happening now that Health Alliance has left that party, and Aetna and other people have too. All right. So one of these announcements, the People's Agenda, September 24th at 3:30. You can join the People's Agenda for an afternoon of training, planning, and doing. Topics include how to lobby effectively, how and why you should get involved in campaigns, how and why we need to fund progressive candidates, and an overview of the Illinois House and Senate races. Also, we'll be able to help people try to identify where they would fit in within local boards and commissions. So, for instance, if you're interested in mental health, how could you get on the mental health board? What's happening with the racial justice task force? That's all these appointed boards. There's any number of them, and that'll all be explained on that day. There's never been a more important time to get involved in local politics. You may feel helpless about the overall big picture of politics in at the national level, where one vote doesn't make that much difference and you sort of feel helpless with the Electoral College, how it is, but where your actions make a tremendous amount of difference is in local politics, where literally elections are won and lost by a handful of votes often. And we can talk about that with David Gill's race when we get to that story. So that is for the People's Agenda. That training will be September 24th at 3:30, sponsored in large part by Carol Ammon's office and organized by Danielle Chenoweth, a longtime organizer here in Champaign-Urbana who's done so much good in the area. And other people are organizing it too, Michelle Jett and others, so hats off to them. And we welcome you to any part of the event that you can. And more info about the agenda is available at Carol Ammon's website, so CarolAmmons.com. There is going to be a big old party this weekend called the Labor of Love, Labor of Love Concerts. That's a fantastic full day of art and music at the Urbana Champaign IMC at 202 South Broadway Avenue in Urbana. This event will benefit the IMC and serve as a kickoff for 90.1 WEFT FM's Fall Pledge Drive. Musical guests include Americana, folk, country, rap, hip-hop, electronica, and more. Those aren't the guests. Those are the genres, of course, but there you go. For a complete listing, you can look for the Labor of Love Facebook event. I personally am going to be displaying my paintings there as well. I've been a active painter and used to be showing all the time and doing a lot of visible public work. But as of late, I haven't had a show for, I bet you about 3 years. So I'm going to be showing 10 new paintings that I have done and bringing out some of my 4 of my classic paintings and 1 portrait of my grandma. The concert is organized by Wefty and local music promoter Todd Durnell. As I said, it's all the way from... I think it starts at 11 o'clock. I'm not positive about that. It goes to, and maybe it starts at noon and it goes, that's right, it starts at noon and it goes to 11 p.m. Kevin Elliott, who plays the music before the show and who is my husband, is going to be playing at 1 o'clock. So if you like singer-songwriter stuff, that's happening earlier in the day, and I think it's getting more loud and raucous as the day goes on. Mark your calendars for September 7th. When WEFT will be hosting a street fest here on Market Street with food booths, live music, and activities for all ages. And that is, of course, part of our Fall Pledge Drive. And if you haven't heard, we're having lots of live music in the studio for the next couple of weeks as we get that kicked off starting next Saturday. But if you didn't catch this WEFT this weekend, you missed some really good live music. Friday night, on the Hip Hop Express, they had a live band, and we're just throwing it at you all the time. So I hope you're tuning in a lot to WEFT and seeing what we have going on, because we have a lot of new stuff going on all the time. All right. So now to the news. I wanted to talk to you about David Gill, who's making his 5th run for Congress. You might think, oh my gosh, 5th run. Back in 2004, 6, and in 2010, he ran as a Democrat, losing to 15th District Republican Tim Johnson. I wonder why he's called 15th District. I'm not sure about that, because we're talking about the United States Congressional 13th Congressional District. So this is a Washington, D.C. seat where we have several representatives from Illinois go to the House of Representatives, and that has long been dominated by the Republicans. It's really hard for a Democrat to win that seat. But Gill has come close. He was running as a Democrat in those elections, and then in 2012, they changed the makeup of that district around, and Johnson retired, and at that time, Gill came really close, within 1,002 votes of beating the Republican in that congressional district, which is just amazing. So again, if you think your votes don't matter, please know that they really do matter at the local and state level. He almost won that by 1,002 votes. He was only short. That's less than 0.3% of the vote. And he says that was pulled from him by someone who was running on virtually the same platform as himself as a third-party representative. They had the same kind of agenda: climate change, gay marriage, single-payer health care, and a woman's right to choose. So a lot of progressive causes. And those were he effectively won that platform, but the votes were split between him and a third-party candidate. So that happens. But the Democratic Party did not want Gill to run again. However, he said, I'm not done. I think I can get this. I want to be your representative. He's an amazing man, many times myself. He's actually an emergency room physician over in Bloomington. And so he wanted to run as an independent. So the deal is that it's virtually impossible to run as an independent in Illinois. So in order to get on the ballot, a Democrat or Republican has to get about 700 signatures, but a independent party has to get 10,000 signatures. And then they decided, oh, that's not hard enough. You have to get them in 90 days. You can't start before 90 days before the ballot is getting printed or something like that. So there's a 90-day window that you have to get literally 10,000 signatures. And then they put another hoop on it that you have to have every page of it certified. So somebody has to go through and certify every one of those signatures to make sure that they're signed by the person who lives at that address. So it's just literally a crazy system that it's just part of Illinois shenanigans. And Gill said that literally no one has ever been able to do it in the state of Illinois, get on the ballot even in the congressional races outside of Democrats or Republicans. I think Green Party has, but an independent has not been able to. So a Green Party has been able to, and they have some status now so that they don't have to get those signatures that many. But so anyway, so what happened was that the law was aimed squarely at protecting incumbents from competition. And Dr. Gill did not gather the required number of signatures needed to get it on the ballot, but he appealed to the Illinois Supreme Court, the Illinois court, saying that several provisions of the election code violate the First and 14th Amendments of the U.S. Constitution, specifically the plaintiff challenged, number one, the notarization requirement, two, the 5% minimum signature requirement as applied in light of the fact that the district is rural and geographically large, three, the 5% minimum signature required as comparative to signature requirements for other candidates, and four, the cumulative effect of the 5% minimum signature requirement and the 90-day signature gathering period and the splitting of population centers, virtually assuring that no one would ever get it. And indeed, I think that number of signatures has only been attained for congressional races across the United States 3 different times. So that's how nearly impossible it is to do that. But great news that on Friday, Judge Sue Myerscough in Springfield ruled that he must stay on the ballot. So Dr. Gill then in victory says half of the board is Republican and half are Democrats. This is of the, what board is he referring to? The board that does the maps, I believe. I'm not sure about that. Clearly, they're wasting the taxpayer money to monopolize the election process for themselves by trying so hard to keep even one independent from getting on the ballot. Our experts testified that no independent candidate for the U.S. House has ever overcome this excessive and severe signature requirement. What is so wrong about letting the voters of the 13th Congressional District decide who represents them as opposed to the 8 appointed Republican and Democratic politicians? He further said that our polling demonstrates that my independent campaign will be highly competitive in spite of the obstacles built into the system by the two major parties. So go David Gill, go Dr. Gill, see what you can do there. Well, kind of on the same topic, we're going to talk about the MAP referendum that we've been covering since it's been a group has been really pretty much a bipartisan group has been trying to get the a MAP referendum for redistricting the congressional districts. And here we're talking the state. I don't believe this has anything to do with the congressional districts of the U.S. House and Senate, but rather of the state. So I'm going to mostly be reading from an article at illinoispolicy.org, which is a pretty right-wing news site, but I actually think that this is a bipartisan issue. I would have really liked to seen it succeed, even though, anyway. So the Illinois Supreme Court affirmed an earlier decision keeping the legislative map-making process in political hands. In a 4-3 ruling, the Illinois Supreme Court erased the November ballots on a erased from November ballots a referendum on legislative map-making and handed a major victory to Illinois House Speaker Mike Madigan. In its ruling, the Illinois Supreme Court affirmed the July 20th decision from Cook County judge. This stands as the second time in the last 3 years that Madigan's top lawyer, Michael Casper, has successfully sued to stop map-making reform in its tracks. This referendum in question came after a nonpartisan Independent Maps Coalition filed 570,000 signatures with the Illinois State Board of Elections in May. And I bet you that's the board that Gill was referring to too. If successful, it would have shrunk the Speaker's influence in the legislative map drawing by putting that process in the hands of a broad coalition rather than the winner-take-all system that has allowed the census each decade. Has followed the census each decade since 1970. So basically, the story here is that gerrymandering is the story, basically. So they redraw the maps so that it doesn't matter if they know they're going to lose, that's an area that's primarily Republican, they try to draw those Republicans into that one big area and contain them there, and then give districts that have more Democratic influence, or that you can, will carry Democrats, they'll take pieces of Republicans from that and put it in with a majority Democrat. So Urbana gets put in with someplace that could Urbana would help it carry Democratic, and sort of it is total gerrymandering. It's bizarre and it's crazy, and there is no reason that it needs to that we need to keep having Mike Madigan, who I applaud him for standing up to Rauner in the budget, but I have no use for him really myself. He is not a good politician for the people. He does not represent the people well, and and there is this gerrymandering that keeps him elected. So we'll have to cover that another day, but the unfortunate decision of the Illinois Supreme Court that referendum on remapping is not going to be on the ballot in November. Okay, it's 6:18. You are listening to CU Progressive News, and let's see, what do we have going here? So we talked about Gill, the mapping referendum, and I'm going to cover health insurance, and then remind you that Claudia Lennhoff is coming in around 6:25 to 6:30, and we're going to have a short story on labor before that. This is reported by RebootIllinois.com. Illinoisans, we from Illinois, who purchase individual health insurance plans through the Affordable Care Act, the Obamacare exchange, likely will be hit with hefty premium increases and have fewer choices come 2017. Illinois Department of Insurance rate filing submitted by the Illinois Department of Insurance on Wednesday showed premiums for the second cheapest silver plan, which is considered the benchmark plan, will increase by an average of 43% next year. Statewide, the average increase for the lowest priced bronze, silver, gold plans could jump as high as 44, 45, and 55% respectively, according to the preliminary analysis of data submitted to the federal government. The Center for Medicare and Medicaid Services will finalize rates sometime in October, although some regions in the state premium increases could be even higher. Many will see their premiums skyrocket. The Department of Insurance analysis, though, does not include tax credits that nearly 78% of residents who purchase plans through the exchange receive. So the price rates go up, but will the tax credits go up also? So the people who are purchasing with that tax credit, people who qualify because of income, how will that affect them? That's a question we want to ask Claudia and see what she knows about that. An analysis released last Wednesday by the U.S. Department of Health and Human Services estimates that about 65% of people from Illinois would pay $100 or less, even if premiums for the individual plans in the marketplace double. And that is $100 or less per month. But interestingly, the cost for people who don't have somebody helping them pay their premiums is $368 is what they estimate will be for a 21-year-old who doesn't use tobacco. So that would be somebody who should have a pretty low rate, 21, and doesn't use tobacco. But the thing that's really worrisome that I'd like to get Claudia's opinion on, and that hopefully we'll talk about, is all the people that are, all the insurance companies that are leaving the healthcare exchange. Aetna and United Healthcare have announced they will be leaving the Illinois Exchange at the end of the year, citing cost. Additionally, the nonprofit Land of Lincoln Health and Obamacare Co-op was taken over by the Department of Insurance and shut down in July after losing more than $160 million in startup money. And so coverage for them will end on September 30th, people who had that. And then locally, Health Alliance has announced that they're not renewing their plan called Health Alliance Connect. So I think locally that just leaves us with some Molina is the only people locally who can provide us insurance through the Affordable Health Care Act. So again, then that brings the problem of no competition with that. So we'll be talking to Claudia about those issues and more when we come back. Right now, I'm going to move us into a section on labor. Let's see, maybe just as a little lead into that, I will tell you about another event that's happening labor-wise, and also encourage you to listen to WEFT on Saturday mornings. I always like to plug my Saturday morning show because it's such great lineup here, and you can learn so much by listening to WEFT on Saturday mornings. Starting at 8 o'clock, where you hear Higher Ground with the Ammons, Carol and Aaron Ammons, alternating with Eunice Buckner-Boone, always talking about issues of interest to the African-American community and those of us who are allies with that community. And then followed by Paul Muth and News from Neptune, who he quotes Noam Chomsky, saying, if you do more than sound bites, you sound like you're from Neptune when you talk about the true stories behind the stories. And so Paul always brings a nice mix of information that he brings from various programs and weaves them together with how they pertain. And then follow that by the Labor Hour, which has been ongoing for almost 20 years on WFT, I believe. So the history of labor on September 15th from 6 to 7 p.m. is a fun, informative evening called Celebrating Labor's History in Champaign County, covering the history of labor and the county and all of Illinois. It's going to be held at the Laborers Hall, 108 East Anthony Drive in Urbana. And, I also missed telling you about one other event now that I'm seeing this. First Friday in Urbana is a new event that's happening. Have you heard about that, Saxon?
I have.
Yeah, it sounds like fun, doesn't it? History of First Fridays in Urbana is going to be happening, I guess, every first Friday probably, but Imbibe Urbana is a new group who is kind of organizing this series, which kicks off on September 2nd, this coming Friday. It's from 4:30 to 11 p.m. You can hop from happening to happening along the streets of downtown. Art openings, performance art, live music, food and drink specials, fitness activities, retail deals, happy people, Friday vibes, and family fun. Stop and see the paintings displayed at the IMC, which will be mine. All proceeds from the sale of those paintings will benefit WEFT. If you want to know more about that, you can search on Facebook for Imbibe, I-M-B-I-B-E, Urbana, to get a listing of all the fun events that are going to be happening there. So now we're going to go to this recording that I did this morning with Ricky Baldwin.
Hi, I have Ricky Baldwin on the line with me. He's the Assistant Director of the Downstate Division of the Service Employees International Union, SEIU, Local 73. Is that right, Ricky?
That's right.
Welcome to CU Progressive News.
Hi, thanks. Thanks, Sandra.
Yeah, Ricky and I have been friends for a while, and I noticed on Facebook that he was posting some labor news that I thought our listeners would be interested in. We always try to bring some labor into the picture each week. And he was saying that, so first to say that SEIU represents 29,000 public employees in Illinois and Northwest Indiana, the Local 73 does, but it's a national union. Oh, well, international it says.
Right. We have some members in Canada, and I think it's mainly Canada.
And locally, you represent a lot of the workers at the University of Illinois, right?
Right. That's my main assignment, building service workers and food service workers at the University of Illinois.
Gotcha. So this action that's going on right now, apparently there's 2,000 of your people that you represent, that SEIU represents, that work for the Illinois Secretary of State's office, which we're all familiar with that. They test for the driving license, process license plate applications, all that kind of stuff, right?
Right, that's right.
And there's some action that was taken against 3 different levels of workers at the state Secretary of State's office. I guess you would say action taken. They were told they could no longer be part of the union, right?
That's right. Yeah. The Secretary of State's office took the initiative based on a law that was passed a few years ago, about 3 years ago, I think, that bars certain employees who do certain kinds of high-level decision-making functions from joining the union. And these folks don't do any of those things, but the way the law was written was a little unclear, so they were able to use that to get the labor board to rule that they could no longer be in the union.
And how many people does that affect?
It's a small number. There's usually 1 or 2 of these folks at each driving services facility. Mm-hmm. And there's quite a few of those around the state, but it's not a large number of employees.
So why are you going to bat for it? Do you think it represents something larger, or just for those few employees?
It's just for those few employees. It really has to do with them having the rights under the union to, like, for example, if they try to fire them or something, they at least have some kind of procedure requiring some kind of evidence that they actually did something wrong, certain kinds of protections that they have under the union, and of course we negotiate for their pay raises and things like that.
Mm-hmm. And so the labor board, which is full of Roner appointees apparently, ruled for the governor to kick these employees out of the union. It was the governor's office that actually sort of brought it to the forefront and said that they could no longer be in the union? How did that work?
I don't know that the governor's office was directly involved in this. It came from the Secretary of State's office. But obviously he's in favor of kicking people out of unions. So his appointees on the labor board would be on that side of things.
And who else appoints to the labor board? So this is an Illinois labor board, is that correct?
That's right, for public employees. No, the governor appoints them, and they get to stay, and there's a turnover there, and so when he came in, he was able to appoint several new members to the labor board. So they're dominating the labor board at the moment. Mm-hmm.
And so right now what has happened is that SEIU, appealed and requested that the labor board decision would be checked in court. Is that correct?
Right. Of course, we think the decision was wrong, but also these things drag on in court for a long time, and so we filed a motion that in the meantime, these employees, while we're disputing it, should be allowed to remain in the union and have those rights that come with a union contract. And the labor board ruled in our favor, which is good.
The court ruled
not the labor board. Yeah, the appellate court ruled in our favor, but it's good because they get to stay in the union, but it's also good because it's a signal that we have a pretty good chance of winning at court. They won't give you a stay if you don't have any chance of winning in court.
Mm-hmm. Mm-hmm. Good to know, then. A small victory, but a victory that you'll take.
Yeah, that's right. Well, fingers crossed, for the final ruling. For these folks have been waiting a long time for a decision, and of course they want to stay in the union.
And just to change the subject briefly, but could you give us an update on how you feel, what's going on with the SEIU workers at the University of Illinois? I know that they're having their health insurance threatened in some way, right?
Yeah, well, that's actually all state employees. So currently the negotiations have been going on with AFSCME, who negotiates the health insurance for all the state employees. And they've been at a standstill since January, I believe it was, when the governor came in and declared that they were at impasse, which is a technical term that means that they don't have anything left to talk about, basically. usually that only happens when both sides have been talking about the same matters over and over and haven't really gotten anywhere. But in this case, AFSCME had made new proposals the same day, so we think they have a pretty good chance of winning. But the upshot of it is that if the governor wins and is able to declare impasse in those negotiations, he can impose his last, best, and final offer under Illinois law, and that would include.
He can impose it. So if it's declared that the impasse is the correct thing to have done, I guess by the courts, is the courts who would decide that?
Well, this would be the labor board.
The labor board, okay. Yeah. Oh, that sounds bad.
Right. Yeah. But he did make there is some positive sign there too, because the governor's office, after the first step of the testimony, which is to an administrative law judge, the governor proposed to skip over that step and go straight to the labor board. The administrative law judge is supposed to make a recommendation, and then the labor board either follows it or doesn't follow it in a case like that. And the labor board turned him down. They said, no, we want to hear the ALJ's recommendation. But yeah, he would get to, if he wins, he gets to impose the conditions, which is an entire contract for AFSCME, but for the rest of the state employees, it also means health insurance increases. People would pay double, or if they have dependents, more than double what they're paying now for health insurance. So it could be a pay cut, essentially, of several $1,000s for all states.
And literally, some people would not be able to afford their health insurance.
Yeah, that's right.
There would be people left without health insurance who are state workers.
That's right. And probably that's the objective, is to force them to go onto the exchange or something like that.
But just to say, the exchange is practically broken down with the Health Alliance having moved out of the exchange locally in this area.
And they can't get a subsidy if their employer offers health insurance. They can't get subsidized on the exchange. So they can go there and find a better, to try to find some health insurance, but they won't get any subsidized health insurance because the employer offers it. It's just out of their reach.
Well, we'll be talking about that tonight on the news with Claudia Lennhoff from Healthcare Consumers, who's going to help us dig through what's happening with regard to the Affordable Care Act. So, good. Well, Ricky, thanks for talking to me today, and we'll be in touch as more labor news unfolds. Thank you.
Okay. Well, thanks a lot, Sandra.
Take care. Bye-bye.
Yeah, bye.
Okay, back live in the studio here with Claudia Lennhoff. Hi, Claudia.
Hi, Sandra. Thanks for inviting me.
I'm so glad you're here. So, Claudia is with Champaign County Healthcare Consumers, and you've been an advocate with them for a long time.
19 years.
Yeah, I was thinking, it's about as long as I've been in town. It's about as long as I've known you, so... And I really do appreciate all the work you do. You've helped us navigate a lot of things as a community with a lot of healthcare issues that we've had.
It's complicated. Yeah,
it is. It's not getting any less complicated either. And so I want to start with talking about what we were just talking about with Ricky there, which is how to understand the Affordable Health Care Act and what is going on with that. And then I would just like to talk to you about the sort of the overall big picture of behavioral health and mental health issues in Champaign County, because it is pretty dire and not getting any better by the minute. And I think everybody needs to understand really how dire it is and not take it lightly, and just really understand that we as a community are really throwing away a lot of our most vulnerable folks, and they're ending up in jail, unfortunately.
Or on the streets.
Exactly. And if you've been in downtown Champaign lately, you can see it. It's very visible that it's changed in the last 2 weeks, even more all the time. So let's talk about the Affordable Health Care Act. You corrected me and said Health Alliance is not getting out of the Affordable Health Care Act. So what is their plan called that is part of the Affordable Health Care Act? Do you know?
Yes. Well, they have a Health Alliance plan that's offered through the marketplace, which is created by the Affordable Care Act, and that's where people can go and shop for private health insurance. And if their income qualifies them for subsidies, they can get tax subsidies to help make their insurance more affordable. But I think the focus that you wanted to have regarding Health Alliance was more with Health Alliance Connect, which is a Medicaid managed care plan. It all relates to the Affordable Care Act, but basically what happened is that when the Affordable Care Act was fully implemented, there was the creation of these health exchanges, so healthcare.gov for people who have been out there shopping for health insurance that way. And then the other big change that happened is that states had the opportunity to expand Medicaid to cover low-income individuals, and the only criteria for qualifying for Medicaid under expanded Medicaid is just your income level. And fortunately, the state of Illinois did choose to expand Medicaid, and so we have many more, thousands more people covered in our own community because so many qualified for Medicaid. Now, layered on top of this...
Can I maybe ask one question there, just so I understand? So, the only thing you have to do to qualify for Medicaid, for Health Alliance Connect then, and for Molina would be, you said income, that's it. What do you have to do to qualify for the tax credits that come to help you make affordable the marketplace plans?
Have a higher income. Basically, and I should have brought my handout that has the chart and the income levels and household size, but I apologize, I did not bring it, but it's on our website. Mm-hmm. But basically, if somebody's income is above the equivalent of 139% of the federal poverty level, they would go through the exchange or through the marketplace. And for a single individual, that would mean an income that's higher than about $16,800 roughly. Mm-hmm. Somebody who has an income lower than that in our state would qualify for Medicaid. And the reason that the Molina Health Plan and Health Alliance Connect came about was because the state of Illinois, prior to the full implementation of the Affordable Care Act, had decided that they wanted to move Medicaid individuals into managed care, and Champaign County actually happened to be one of the Medicaid managed care mandated counties, and it just so happened to be taking place at the same time that everything else was happening, that the exchanges were happening and so on. So basically what happens is if we have somebody who qualifies for Medicaid, we apply them for Medicaid, they get approved, and then the next thing that happens is that they will be offered a choice of managed care plans. In our community, that's
explain what a managed care plan is.
A managed care
as opposed to how Medicaid worked before, I guess, or...
Okay, previously Medicaid, outside of managed care, Medicaid is fee-for-service, and people just, go to the doctor or seek emergency services. But there's the insurer, the Medicaid, the state of Illinois, is not working to really look at how people are using health care, and they really don't have networks of providers. Mm-hmm. Whereas a managed care plan has networks of providers, and they can provide the managed care plan itself can also provide higher level assistance to individuals. For example, you might have an individual who has many complicated healthcare issues, chronic health issues, and they actually need help sorting out which doctor they go to when and making sure that the physicians are communicating with each other, or they may need support to make sure that they're doing all of the things they need to do on an outpatient basis. So a managed care plan is a type of insurance, but it's more highly organized and has a network and can help manage the care of one of the members. Okay. So basically, once somebody qualifies for Medicaid now, they will be given a choice of Health Alliance or Molina to choose a managed care plan in this community. Health Alliance has been, let me correct myself, Health Alliance Connect is the Medicaid managed care plan, and it has been incredibly popular and incredibly effective. It's been wonderful for our clients. Yes. One of the ways that it's better than traditional Medicaid is it provides more benefits in terms of vision and dental care than just traditional Medicaid would provide. Mm-hmm. And then the other thing is it had a much more robust prescription drug coverage plan. Under traditional Medicaid, people had a 4-drug limit. There is still a 4-drug limit under traditional Medicaid. And of course, you can get that waived, sometimes, but it's a lot of bureaucratic process dealing with physicians and so on. And then the other thing is it comes with small copays at the pharmacy, and it might be $3 and $4 copays, but for low-income people paying, $12 or $16 if they have multiple prescriptions each month could be unaffordable. And under Health Alliance Connect, frequently those same medications were covered completely with no copay. So it's been a great plan.
But it's going away.
It's going away. It will be ending December 31st.
So will people
this year.
either sign up with Molina or go back to regular Medicaid?
So it is uncertain what is going to happen. We're all waiting right now to hear more from HFS through the state of Illinois communications. Health Alliance Connect will stay in touch with its members and also inform them, but there's several different possible scenarios. One scenario is that if there isn't another managed care plan to choose from, people who have Health Alliance Connect may have the option of just reverting to traditional Medicaid. And under that scenario, they would be able to continue to see their doctors. For example, if they go to Carl, they could still use traditional Medicaid at Carl and not have their care interrupted. They may also be offered the option of choosing Molina, however, hopefully not forced into Molina, because I doubt they would be forced into Molina, actually. But Molina's network is pretty limited in Champaign County. For example, it doesn't include Carl or Christie. It does, however, include Francis Nelson Health Center and Presence Covenant, but it really depends where you get your care. And so another option might be, and we just don't know yet, it's a possibility that a new plan might be offered in this community if it's allowed by the state HFS. So what I would say to consumers who have Health Alliance Connect, and you'll know you have Health Alliance Connect if you look on your Health Alliance card. It'll say that on the top left, I believe. But just don't panic. Just stay tuned, open all the mail that you get from Health Alliance and open all the mail that you get from the state of Illinois, from HFS. And you can also contact us if you get mail and you're not sure what it means, and we'll help people sort through this.
Now, tell them what your phone number is and your website.
Thank you. Our phone number is 352-6533, and we're on the web at www.healthcareconsumers.org, and people can reach us those ways.
Okay, so Claudia and I worked together on a task force that was kind of about the Stepping Up initiative, which was organized by the Sheriff's Department and the Champaign County Mental Health Board. And we met for several months with lots of players from the community, thought we were maybe going to get an RFP, a request for proposal, to put together a detox center / crisis drop-in center, which looks like our community really desperately needs, because we have people who are addicts who don't have any place to have medical detox, and we haven't since the Prairie Center closed their detox center 12 years ago, I believe, or something like that. Pretty close to that anyway. And so, one of our problems is our jails are filling with people who are mentally ill and who are just in crisis, maybe not even chronically mentally ill, but they have a mental crisis or a crisis of some kind, and the sheriff has no place to bring them except jail, even though because their family says, you can't stay here tonight, you're causing too many problems, whatever. So crisis drop-off center. And Bexar County, Texas was brought in, a guy from Bexar County, Texas, Leon Evans, he came to speak to the community and to different players in the community, and looked at that model, which is in place in several places, right? Besides Bexar County, do other places use that you know of?
Bexar County, San Antonio, which is in Bexar County, has the most comprehensive model, and I was fortunate actually to have just visited it recently on my trip home to Texas. But it is the most comprehensive model, and it's something to aspire to. But I think it's important to note that Bexar County and Texas is very different than Champaign County and Illinois in terms of how their mental health services are organized. The county is actually the provider of mental health services, and so it's easier to get government to talk to each other, and it's a more seamless system. But yeah, they have a really beautiful model, and it's taken them over 12 years to get there. And they started in a very similar way to what we have started.
I wonder if they started with the same kind of outsourcing of services, because, right now, so just to explain to the listeners, our mental health board is Champaign County Mental Health Board does have money from a property tax levy that happened. They get $6 million a year approximately to divvy out among disability organizations and mental health organizations. So $6 million is our budget. That's it for mental health and disability services from Champaign County. And other than that, we rely on grants from the state and from Medicaid paying their bills, right? That's a lot how organizations are funded.
And from the federal government.
And from the federal government, exactly. And so we have Community Elements, which is now Rosecrans. They have been in the community as, they had a name before Community Elements. They were Champaign County Mental Health Center, right? Mm-hmm. But they are, which leads people to believe, if you know that history, that they're part of Champaign County's Mental Health Center, but they are not.
Yeah, it's like our organization, Champaign County Healthcare Consumers.
Right,
we have to let people know it's just our name.
Yeah, right. But people do have the idea that Community Elements is somehow affiliated with the county, and in fact, they're not.
That's correct. They're a private nonprofit,
right?
Service provider,
right. And so we have them. We have Prairie Center, who is locally owned, private nonprofit. We thought they might get bought out this year by someone, but that did not happen, so no merger happened there. And we have Promise Healthcare, which used to be Francis Nelson, which is offering some mental health services. They have a psychiatrist and a counselor on some counselors available, and you can get your meds managed there if you get all of your health care there. That's one of the limits that they have. So we do have some resources in town, but they're all woefully underfunded and struggling. And so we're left with, I guess, a difficult situation to say the least. But the Time Center, which is the men's drop-in center, so it's sort of an urgent issue.
And it's I wouldn't necessarily describe it as a drop-in center. It's a men's shelter.
Right. Yeah. They have two programs there. One is transient housing for people who are on a path toward homeness, not homelessness, but. It's
described as, level 1, which is emergency shelter, which is gone now, and then level 2, which is more of the transitional housing.
That's what I meant to say, not transient. Transitional. So, and Salvation Army closed their emergency shelter down in April. So literally, that's why the problem in downtown Champaign looks like it does today.
Yeah. And Courage Connection has also lost funding as well. Basically, what happened is that besides the problems with the state of Illinois and not having a budget, and then even when they passed the stopgap budget, paying late and not paying for everything, part of the problem is that the federal government has actually defunded emergency and transitional housing because the federal government is moving towards this model called Housing First, where they really want people to be housed immediately in permanent housing and not go through emergency sheltering and transitional housing. And not every community can do that. And even when you look at the Bexar County model, they have all different levels of housing.
Absolutely.
They even have a place that's called the Courtyard, which is a place that just basically has bunks and people can just drop in and stay there, and they're not required to participate in programs or anything. They're really literally just being sheltered, and because for some people that's where they function best. Other people function best when they're able to move into housing, but a certain from the Bexar County perspective, a certain percentage of their homeless population really did not do well with Housing First or being housed because they felt alienated from their peer groups. they started decompensating, getting worse in terms of their mental health and so on. So for Bexar County, they feel like they have to have all the different kinds of models, but the federal government cut a lot of funding for our community in terms of the housing that we did have available.
Right. And I think that the misconception about why the Times Center closed down, though, is the idea that, well, our state's in this bad place, so we're just going to wait for the state to get back and get their budget, and then the Times Center is going to open back up, but that's not going to happen. So from what I understood, I went to a meeting on homelessness a week ago, and the words that were used by the United Way is like that door is closed. So we're not going to be talking about how to get the Times Center reopened because that door is closed. And so that is just something that I feel like the community needs to know, and we need to figure, because the Times Center is owned by community elements. They own the building. Rosecrans now owns the building. And I'm trying to figure out how that could have happened. I feel
what could have happened?
Well, how it could happen that we as a community used our resources to find a location for the Times Center, to get the governmental bodies together to provide some initial funding to get the Times Center open and up. We closed down what used to be the McKinley's men's emergency shelter, and now all of a sudden we're left with this is closed and it's not going to reopen.
I'm sorry. I'm going to try to unpack a lot of what you just said, because there's a lot in there. I think, first of all, nonprofits can have assets. They can own buildings and so on and provide programs in those. And I think, and I'm not as familiar with the whole evolution of the men's emergency shelter, but it started out many, many years ago on campus. Sheila Ferguson, who is the executive director of our Rosecrans locally, actually started out as one of the first executive directors of the I believe it was men's winter emergency shelter. And over time that grew, and then I think that, I'm not sure of the history, so I think you should talk to her or somebody knowledgeable about that. Yeah. But at some point, community elements began operating the shelter and the Times Center is their asset, and so the shelter was located there, and then and I think the merger with Rosecrans is actually, I might be wrong about this, but I think it's actually incidental to the closing of the level 1 housing at the Times Center. I think that path had already been laid a while before the Rosecrans merger because of the budget issues. I had some information about some of the changes that they had gone through, but I think it's important for people to know that that Times Center was actually losing money already. All the years that Community Elements has operated Times Center, I believe there was only 1 year when it was in the black, when revenue was meeting expenses. So in other words, we had a community-based organization, Community Elements, that was subsidizing Times Center beyond what grants were paying for, beyond what specific fundraising was covering. And but anyway, loss of funding occurred for the agency from 2015 and into 2016, and then that led to some of the reduction in the Times Center. The first reduction was that level 1 went from a 50 pad or bed program down to 20. Mm-hmm. But at the last census, before they closed down the level 1, they weren't even full at the 20 beds. And so what they ended up doing is maintaining the level 2, which is much more intensive services, and that's a 20-bed private area of the building that has 10 two-room units, and then there's a whole array of services that are provided to those individuals. But basically, funding has been lost. It's not just federal funding, it's also state funding. And I don't know where this is. Okay, so, one of the things that in the state of Illinois that in terms of the cuts in funding is that funding for addiction and mental illness prevention and treatment has been continually reduced by the Illinois General Assembly. In the past 5 years, for example, the legislature has slashed state funding for addiction prevention, cut addiction treatment by 40%, and mental health treatment by nearly 25%. So those are cuts that organizations like Community Elements, Rosecrans, Prairie Center are facing just across the board, and they have multiple programs.
As do every city and town in Illinois. And it's said that that the Cook County Jail is the largest mental health facility in the country. That's 5 minutes. Oh my gosh. So we have laid a lot on the CRPC in that the Crisis Response Planning Committee, and that the sheriff is basically forced to deal with all the mental health crises in Champaign County, because we don't have the detox center, we don't have the crisis response center. Now we don't have a men's emergency shelter. Our beds at the women's emergency shelter have been cut.
Right. Although I do want to clarify that those emergency shelters were not where you would take somebody in crisis, but I get your point that people can, if they don't have a place to stay and they're out in the streets and so on, that things can get worse and they can end up in crisis. I guess one thing I would like to talk about real quick, this won't take long, but I want to talk about some of what our community is doing that is working well, because we actually do, I know it's hard to see in the mix of everything that's happening, but we do actually have some very good things that we are doing that we're actually helping to lead the nation in doing, believe it or not, that is actually reducing incarceration of people with mental health issues.
Tell us.
So one of those is we do have a drug court, so that can help divert people and keep them out of jail.
We don't have a mental health court.
We don't have a mental health court, and I think we should.
Yeah.
And it should come back. And Bexar County, Texas has a mental health court, and it's really important. We have mental health practitioners in the jail so that people can have linkages when they get out and hopefully reduce recidivism and get people care. We have a specialized criminal justice case management and service linkage. We have bond courts 7 days a week, so that helps reduce people's stay in jail, and this is important. And we have cooperation between the state's attorney, jail staff, and mental health practitioners to identify and link to services as alternatives to incarceration. And I think, that has been pretty effective in helping to reduce the census in the jail. We have evidence-based practices such as moral recognition therapy and motivational interviewing. And one of the really big
where
things,
do we have those?
In the jail, and then also at Community, or Rosecrans, And then one of the very big things that we have, and how Bexar County actually started, is that we have CIT trained officers. That's crisis intervention officers who, when somebody is having a crisis and police are called out, you can have these specialized officers who know how to de-escalate a situation, who know how to identify people who are in crisis, and who then can help link them to services rather than just in the past just taking them to jail.
Right.
And those are positive things that we have. We need more.
Way more. Because those are services in the jail mostly, and once people are in contact with the system, and it's trusting the police to do crisis intervention training.
Well, these are not just services in the jail, like the CIT trained officers. That's hopefully before somebody gets to the jail. And one of the things that we're working on, there's a whole sequential intercept model where you can look at people from the moment that 911 is called or they come in contact to police, all the way through if they were actually incarcerated and then let out, and then you work on reentry. What we're trying to do through the CRPC is to figure out interventions in intercept 1 and 2. 1 is when police are called or 911 is called. So that's hopefully before people get to jail, and maybe they don't have to get to jail. And then the second one is once they're in jail. We don't want them to stay there any longer than they have to, especially if they're there because of mental health issues and can be gotten to resources that will help them.
Right.
So it's
right.
both.
We do have to call though on thinking about having more intergovernmental talk about what really needs to be done, because what you're saying it's nice, but it's not anywhere near what we need. And I get that we're
we're not actually making progress because we went a step back when we closed the men's shelter down and have not got a plan to reopen it.
Well, I think there's multiple steps going on. Some are going forward, some are going back. But one thing that I think is really important for our community to understand is the limits of federal and state funding.
Yeah,
and that if
I
there's
do too.
certain, and one of the things that happened with that whole RFP process that you talked about that we were engaged in last summer is that part of what happened is the mental health board said, yeah, we can do that, but if we do that, we can't fund everything that we've been
Right.
funding.
We're going to have
And
the
then
mental health board on next week. So,
great.
yes, Lynn Canfield or Peter Tracy, who is
Great.
the outgoing or ingoing mental health board, is going to be joining us very soon. Thank you, Claudia.
Thank you.
I know it's a rough thing. Thanks for doing the work you do.
Thank you.
You've been listening to CU Progressive News and WEFT 90.1 FM. This is Sandra Ott, and thank you to Saxon for running the board for us tonight and for everyone who's been listening. We appreciate you, and we appreciate if you will make your donation to WEF next week when we start our fall pledge drive.